Okay.
Okay. Okay. Hello,
Give me 1
I'm
second.
Ghada. Okay.
Okay. Now you can start.
Okay. Hello, I'm Ghada. I'm one of the doctors here. Are you Razia?
Yes, doctor.
Okay. Can we start by confirming your full name and age, please?
Yes, doctor. My full name is Razia Ahmed.
Uh-huh.
And
And your age, please?
I am 16 years old.
Uh-huh. Okay, Razia. I can see that you developed a burn in your tummy, and you have been seen by my nurse colleague, and she put a dressing on you. Am I
Yes,
right?
doctor.
Yes. Uh, can you tell me more about this burn, Razia?
Yeah, doctor. I burnt myself today.
Okay. Can you tell me how?
I was just preparing tea, and the kettle just stopped over me, doctor.
Uh-huh. Okay. And since when this happened?
2 hours ago.
Okay. And did you burn yourself anywhere else?
No.
Okay. Anyone was with you, Razia, when this happened?
Yeah, there were some other people.
Mm-hmm. You shared your home with some other people? Recording.
I live in a hostel, doctor. I'm feeling fine. Can I go home?
Yeah, I'm just it's just a small discussion to be sure that you are fine and you are okay, and then we can see if we can discharge you. Is that
Okay.
okay, Razia? Okay,
Okay.
Razia, from your tone of voice, you think that there is something annoying you. Is there anything you want to share with me right now?
No, doctor.
Okay. Apart from that burn, do you have any dizziness?
No, doctor.
Okay. Do you feel weak or thirsty?
No, doctor.
Okay. Okay, Razia, but I'm still concerned about you. You are not well. I'm telling that because I'm really concerned about your condition, and your voice is a little bit not okay. So, do
No,
you have
doctor.
any?
I'm okay. I just want to go back.
Mhm. Okay, and okay, just small questions about your house and your home condition, and then I will let you go home. Okay.
Okay.
You mentioned that you are living in a hostel.
Yes, doctor.
Okay, and you share this hostel with your friends.
No, they are not my friends. These are some other girls.
Okay. Okay. And how with everything at this hostel? Is everything is okay?
Yes.
Okay. So apart from this burn, do you have any other medical condition?
No, doctor.
Okay. And are you taking any medication?
No.
Okay. And regarding you, are you studying or work right now?
I study, doctor.
Study. Okay. And from where can you afford the finances of staying at the hostel?
Doctor, sometime I do some part-time work.
Okay. And regarding your finance, everything is okay, or do you face any difficulties?
Yes, I'm facing some issues, doctor.
Okay. And how can you manage and how can you cope with this?
I don't know, doctor. I'm struggling.
Uh-huh. You seem that you are a little bit under a very stressful situation right now, Razia. So what about your mood right now?
Yeah, doctor. I'm sorry. My mood is not good, doctor.
Okay. Can you score your mood for me? One is the lowest mood and 10 is the best mood ever.
7.
Okay. And since when you feel like this?
Mm, I don't know, doctor. Since last 1 month.
Okay. Is there anything in particular happened in that 1 month?
No.
Okay, Razia. I'm, as I told you, I'm still concerned about you, and I want to tell you that everything is that you can tell me right now. It will be confidential between you and your medical records, okay? And no one can know anything about this, especially if there is no harm for you or anyone else. Is that okay?
Okay. 2 minutes remaining.
Okay.
Yeah.
Okay, Razia.
Yes, doctor.
Okay. So, do you want to tell me anything else apart from having this accident?
Actually, doctor, I don't want to go with the man who is outside the room right now because he's the one who's threatening me and he poured water over me today. He's actually threatening me, doctor. He asking for sexual favors, but I don't want that. So he hurt me today.
Uh-huh. Okay. First of all, thanks for being honest with me, Razia, and I will do all of my efforts to protect you. Okay, and be sure that there is no one can harm you right now. Okay.
Okay.
Okay, Razia. But first, do you are you exposing to this alone, or you have anyone else? You mentioned that you are living in a hostel with another one. Am I right?
Yes, doctor, but he's only threatening me.
Threatening you only. Okay. And what about the other girl? Everything with the other girls in the hostels. Is there any problem with them?
No, doctor.
Okay. Okay, Razia. For that situation, we need to inform a special department which is responsible for such situation, which is called safeguarding. Have you ever heard about this? To
No.
protect you and to protect the other girls.
Okay.
Okay, and by their rule, they will inform the police, okay, to protect you and to arrest this man. Are you willing to go through
Okay.
this, Razia?
Yes, doctor.
Hello? Okay, this will be fine. And
Okay.
regarding
Time
your,
finish.
okay, I didn't answer to it.
Okay, Dr. Gada, how do you feel? How did you perform?
Um, I struggled a lot to make her talk to me, but
Mm-hmm.
I tried by all solution, and I left the confidentiality till the last. I'm still confusing
Mm-hmm.
about this point. Is that the right thing, or I should offer this confidentiality from the start? I'm still struggling for this point, so I don't know what will be the right thing in such situation.
Okay, Dr. Gada, first of all, I would say it was a very good attempt, and you tried to pick up the. Although we are not doing it face to face, there might be some other non-verbal cues that you can pick, like she won't be making eye contact with you, or sometimes she's looking downwards, she's hesitating, she's not opening up, she's sometimes doesn't answer your questions, she's silent.
Yeah.
But in the and the way we did it, you picked up that my voice was very sad, and this you picked up the non-verbal cues. So overall it was good. And the thing that the you are mentioning about offering the confidentiality, there is no hard and fast rule. right? So you first try to be, do not give this impression to the examiner that this station right before entering the cubicle, that this is a domestic violence station. It could be anything. A 16-year-old girl has come with a scalded burn on the tummy, right? It could be anything. So
Maybe
just
an
don't give this
accident.
impression.
Yeah, yeah.
Yeah, it can be an accident, right?
Mm.
So we will not give, we don't want to give this impression to the examiner that we know it right from the start. So if from the very start you start saying that please, everything will be between us and this and that, so it will give that impression. But if you will go with the flow, looking at the patient, examining the attitude, the way she is responding to you, then you pick up the non-verbal cues, and then you do it in a natural way, then you will be fine. So there is no hard and fast rule, just go with the flow.
Okay.
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 And yeah, the one thing that gave me this idea that if I'm an examiner, that you were talking about other girls, other girls, other girls. So have you read in the script that other girls are being threatened too?
No, she mentioned that she's living with others in the hostel. That's what I
Yes.
heard.
So yeah, so when I said, doctor, he's just threatening me, so you can just leave it there, because sometimes
Okay.
they can say, like, doctor, he's bringing men to the hostel, and he's the other girls are also at risk, so there you can say that we will take care of the other girls as
Okay.
well, right?
Okay.
But if
Okay.
she's saying, yeah, okay, so let's start from the start. So you did a very closed opening, that you had a burn and my nurse colleague has done the dressing. So so you can do it in a more open way. Like, it's okay, doing a
Mhm.
closed opening is okay. But
Okay.
in this, if you are suspecting this must be an abuse victim, right, so you can start in a more way like this.
Open
How are
way.
you feeling?
Yeah.
How are you
Uh-huh.
feeling today?
Mhm.
Okay,
Okay.
just to build a rapport with her, to make her comfortable.
Mhm.
And then you can say, I can see from my notes that you had a burn injury today. I'm so sorry to hear about that. Can you please tell me what happened exactly? So this is an open question for her. Okay.
Yeah.
And she might be hesitant to give you any details, so you just observe her, let her speak, and do more data gathering. Like, did you burn yourself anywhere else? Like, you ask some few more questions you can ask. Do you have pain in your burn right now, or do you have any bleeding or discharge? And now you see that she's very reluctant and she is very sad, so you can use it like this. For
Mhm.
example, Razia, I can see that my nurse colleague has done the dressing for you, and you are also saying that you are fine, but I can sense that something is bothering you. Okay, so can you please tell me whatever is bothering you? So you have made a link with the non-verbal cue, and then you are using that. Are you getting my
Uh-huh.
point?
Yes. Yes.
Okay. And sometimes when you are reflection, Dr. Radha, so don't, you said me at one point, like, this thing, something is annoying you. So I think that that's not the correct word. She's not
Mhm.
annoyed right now. She's
Uh-huh.
hesitant, she's reluctant, she might be afraid, something is going on, something is worrying her. So use the right emotion for her. Okay.
Mhm. Okay.
And then you go on like that. You If she doesn't open up, and I will tell you that this simulator will not open up before 6 minutes time most of the time. She's a really good actress. Okay.
Mhm.
So don't get disheartened, just do your data gathering. Keep on what we say, keep on pushing her a little bit, very indirectly. Please tell me, I can feel that something is on your mind. Can you please let me help you? We see patients, daily patients, with lots of problems, and we know how to help only if the patient will let us help. Okay.
Mhm.
And please do not worry, this conversation is between you and us. This
Mhm.
is not going anywhere outside this cubicle. So you can offer the confidentiality, and when you will offer the confidentiality,
Mhm.
in addition to that, ask the right question.
Mhm.
Like, you asked me, do you want to tell me? A more specific question would be, who brought you to the hospital? How is that person related to you?
Uh-huh.
Or
Okay.
you can further inquire about the incident as well. And once she opens up, if she opens up at 6 minutes time, so you don't have much time for the management now. Okay,
Mhm.
just appreciate her. Like, it is a very brave thing that you opened up about this incident with me, right? And I really appreciate you, and this is totally unacceptable, and we are going to help you with that. Now, Dr. Kata, you need to assess that whether this is a high-risk patient, because sometimes this patient can say, I don't want to stay in the hospital. So we cannot force her to stay. Okay. If she wants to go, then we will give her a safety plan. We will give her crisis card numbers, domestic helpline number, and we will say to her that if at any point she feels she is in danger, she can just send a text at that number, and the help will arrive, or she can call on the crisis card and help will arrive, right? And she can go home. But if you think that this is a high risk case, there is no, like in this case, there was no family support, no social support, she's not financially independent, right? And the person is sexually abusing, right? And for example, there might be a question mark about pregnancy as well. If she has been sexually abused, if she's there might be a chance of pregnancy, then it will be an even more high risk case. Then we cannot let her go. We will say that it is not safe for you to go home right now, and we will devise a safety plan for you. And then you can tell, we have a designated person who can take care of all these things. Do you want to have a meeting with that person? And then she can, throw it and some concerns at you, doctor, I'm afraid he's going to hurt me. Okay, then you can say, don't worry, we can take care of that. We will involve the relevant organizations, and we can even involve police if needed. Okay. If she opens up before 6 minutes time, then there is something more you can do. You can more elaborate about that person. How's that person related to you? Tell me more. What is he under the influence of alcohol and drugs when he did that to you? And you can even explore more about her personal lifestyle, smoking, drugs, and alcohol. Maybe she's being involved in something like that. Maybe they give you a history like, I bought the drugs from that person and now he's coming after me. The story could be, and sometimes there can be a twist as well. She will tell you the story like, I am from a far away area, I don't have my documents with me, so that means it might be a case of sexual trafficking, right? So there can be a twist, but approach is the same. What is the approach? Offer the sympathy, empathy, and try to go in an indirect way, use the verbal cues, non-verbal cues, be supportive, and offer the confidentiality. And then mood and all of these, and then you can further ask some more questions about, like, I didn't give you much time for data gathering because I opened up very late, but you can further ask like about friends, about family, right?
And friends.
Yes. Okay, so that was about this station. So overall it was good, Dr. Gada.
Okay, thank you, Dr. Annie. Thank you.
You're welcome. Anyone has any question? Okay, someone is asking, do we need to explore more about the man partner? Is this the first time he has done that? Does he have any known criminal history? Yes. Yes, Dr. MD, that's what I was saying. If we have time and if she opens up early, then we need to further ask about more details about the partner, about the type of abuse, whether it's sexual, it's physical, how many times it has happened, whether there is any drugs involved, alcohol involved, any criminal record, all of the details, right? But if its 6-minute bell has already rung and she is now opening up, just appreciate her and just you can ask one more, tell me more. And whatever information she gives you, now you give her a management plan, because if you won't do that before 8 minutes time, you won't get marks in the management, right? And do we need to admit the patient? I have already answered that question. If you think this is a high risk case, and I have already told you what makes a case high risk, like if she's pregnant or if she's not financially independent, there is no social support for her, if there is any sexual abuse involved, then it might be a high risk case. And we can say that, it's not safe for you to go home, we might need to admit you. Don't say we might need to admit you, we might need to keep you in the hospital. And if she says, no doctor, I want to go, and you think this is a high risk case, you can say, I can involve my senior here and they will also talk with you. But if you think this is not a high risk case, then she can go home. But before sending her home, you will give her the adequate information what to do if it happens again and she wants to have help. And for that, you can even mention, like, keep some money and your important legal documents in hiding, so in case of any emergency you have easy access to them. Please mute yourself, Dr. Lilios. Okay. What was I saying? I was saying, yes, to give her a safety plan and give her the crisis card number domestic. We cannot force her. And one more important thing is we will document all of this. Documentation is very important. So if the patient doesn't want to say we cannot stay, we cannot force her. But when she will go home, she or he will go home, she will remember the information that we have given to that patient, and she will or he will definitely call for help if any further event happens. Okay. What to say if she got afraid when we tell about safeguard and police? Do we need to ask the address of hostel? Achha, what to say if she got afraid when we tell? No, she will be not afraid of the police, but she will be afraid of the partner hurting her. Okay, so you can say that we will not let anyone hurt you. We will have a safety plan. We will involve the organizations, and if needed, we can also involve police to protect you from this. I don't think that she's going to get afraid because of that. Do we need to ask the address of the hostel? If you have time, you can ask, but if you don't have time, just verbalizing this thing in the management that you told me that he is bringing men to the other hostels and other girls are in danger. So we are going to take care of the safety of those girls as well. Just verbalizing it will be your job done, because your job was to identify this case, to identify this domestic violence case and hand it over to Marak, and they will take care of everything. Okay. Okay, any further questions? Okay. I guess this is the end. Today was a long session,
Yeah.
but I hope this was helpful for you all. And one more thing, we are taking bookings for the month of June. So if anyone is interested, so they can contact me. Should we involve Marak or safeguarding? Yes, you can say that. We can arrange a meeting with the person who is responsible for taking care of all these things, and he will then inform you more about all the services that are available to you. And later on, you can also mention Marak. There is no harm in mentioning. Okay.
Thank you, everyone. And one more thing is you can give your suggestions as well for the next session, because most probably we will be having another random station mock on Tuesday or Wednesday. So you can put your suggestions for the topics that you want to see in those mocks, and we will try to cover them.
Whether you people want teaching or counseling or ethics, please, psychiatry stations,
Yeah.
okay, please let us know.
Okay, so somebody is asking for the group link. I am putting group link here in the chat box.
Someone is saying about examination and procedure station. So Dr. Fatma, it's really difficult to do that in the Zoom session, the examination and procedure station, but we can give an idea about how to approach a combined station. We can do that.
For the examination and procedure station, it would be great if you are watching Geeky Medics video, because they are really good at giving exact feedback. But the approach we can discuss it sometime whenever we are doing the station, because we are not having mannequin, and without mannequins it will be difficult. Okay, yeah, sure. We will give an idea about it. Don't worry. And if you want to book one-to-one mock with us, Dr. Rasha is asking. So yeah, you can text either me or Dr. Annie, and we can talk to you about that.
Okay, everyone, all the best. Take care and keep on practicing.
Thank you, everyone.
Have a good day.
I'll see you in the next mock next week. Thank you. Bye.